Hello everyone, Dr. Callanan here, and in this video, I want to do a deep dive in iron deficiency. Iron deficiency is incredibly common. It can cause a whole host of undesirable symptoms, and it leads to reductions in quality of life. This is something that I personally suffered from. I see hundreds of patients with iron deficiency, and I want to talk about it because it's something that we can really easily diagnose and correct. So what are iron deficiency symptoms? Diffuse hair thinning. This is something that I see a lot of, and I cannot emphasize how many patients I see that have been struggling for years with their energy, with their hair is thinning all over, it won't stop shedding. And oftentimes their iron levels haven't even been checked, or if they were checked, individuals are being told that their iron is normal when it's not optimal. And we're going to discuss what the optimal ranges are in this video as well. Fatigue, brain fog, difficulty concentrating, lack of motivation. Pica is odd food cravings. Some individuals can crave ice or they really chew on ice. And you can also have temperature dysregulation. You can have restless legs. You could have muscle weakness. Think that iron is something that assists in carrying oxygen around the body. So you can have a variety of symptoms head to toe due to iron deficiency anemia. Yes, skin as well. You can see some skin dryness. You could say nail brittleness. What are some of the key definitions that you need to know about? Okay, so number one is ferritin. What is this? Ferritin is the storage form of iron. It tells us how much iron you have in storage. It's really important that your ferritin levels are optimal because this stored iron often helps with the nice to have things like growing your hair. Ferritin can be elevated in certain conditions such as inflammation, infection, iron overload, as well as inflammatory conditions like autoimmune diseases. So ferritin is what you have in storage. Iron, that's what the available iron is in the blood. That's the amount that's circulating that can move around. Now, iron is something that can't just be free floating. It can be bound to something to move around, and that's what we call TIBC, or total iron binding capacity. Iron has to be bound to transferrin. That's the only safe way to move iron around the body. Free-floating iron is dangerous. So we have iron in storage, which is your ferritin, iron in the blood, which is your serum iron. Transferrin is the binding protein that moves iron around. You can envision it as like the bus that iron needs to get on to move around. Now, percent iron saturation tells us about, okay, how many seats on those buses, the transferrin, are saturated or occupied with iron. And all of this information is needed to properly assess iron deficiency. For instance, some individuals may only be getting a ferritin level. Ferritin tells us about the stored form of iron. When ferritin's low, we diagnose iron deficiency. That is all true. But what if you have an autoimmune condition? What if you have inflammation due to blood sugar concerns like insulin resistance? That ferritin can be artificially elevated in those states, so you want to have all of this done. Ferritin testing is not expensive. Ferritin is around, $10 to $15 in Canada and the US. An iron panel, maybe $15. So this is not a very expensive test, and you can absolutely order this test on your own. Now, another thing that you have to remember is that iron deficiency is a progression. It doesn't happen overnight. There's progressions. So the first thing that we will see is lower levels of ferritin. Your body's going to go through your storage, right? So you have, you're kind of like a chipmunk. You're storing the nuts for the winter time, and you're going to slowly go through that storage until spring times. And hopefully you have enough to carry you through. Ferritin is the same. What is in storage? So the first early sign of iron deficiency is a lower amount of ferritin. Then what happens is the iron in the blood will go down. Then your body's like, oh my gosh, we don't have enough iron. What's going on? Let's get more buses. So the transferrin will go up. But because there's less iron and there's more buses, the saturation will go down. Then we start to get into the later stages where we start to see lower amounts of hemoglobin. By the time your hemoglobin is low, that is, you've been suffering with iron deficiency for a very, very, very long time. You can have iron deficiency with anemia or iron deficiency without anemia. Regardless, it needs to be treated. Optimal ranges for iron. These are the optimal ranges that, in general, I look for. Now, This can vary from person to person and situation to situation. For instance, if a patient has high ferritin, but they were just sick when they did the blood work, illness will cause ferritins to go up. So in that case, I'm like, okay, great. We need to just repeat it in 3 months' time. We also have to interpret these optimal ranges from a clinical history perspective. So if your ferritin is at 60, everything else is perfect. 60 is a little bit below optimal, but you've got great energy. You're not seeing hair loss. You are not cold. You have no symptoms of iron deficiency. Then you don't need extra iron. Iron is something that's not safe for everybody to take, and you don't want to be taking it long term. So we have to look at both the symptoms as well as your lab work to get an overall assessment. I love these new guidelines. This website, Hemoquidity, Raise the Bar, I love what they're doing. They are advocating that just because iron deficiency is common does not mean it's normal, does not mean we shouldn't test for it, does not mean we shouldn't assist individuals, and does not mean we shouldn't repeat testing. This is a very valuable resource. This website is printed on individuals' lab results if they are in Canada and they're going to Dynacare or Life Labs. This is what I don't care if you're in Canada, I don't care if you're in the US, I don't care what state or province you're in, I don't care what lab you go to. The fact that everybody has different reference ranges makes no sense to me. We need to be looking at optimal levels. Now, for adults over the age of 18, if we look at what range is it that iron deficiency is unlikely? It is unlikely to be iron deficiency when the ferritin is at 101 to 300. So I want iron deficiency to be unlikely for my patients. So that's where I aim for. 70 to 100 is where I want to go to. I have patients who they've been dismissed and struggling with hair loss for years and years and years. No, it's normal. It's just part of aging. Oh, it's not that bad. Your labs are normal. Sometimes their ferritin is at like a 10, a 12, a 3. And I'm like, why are we telling individuals that their labs are normal when they're absolutely not optimal? And something so simple could fix their hair loss, could fix their energy, could improve their quality of life, could help with their mental health. The anxiety, the depression, the isolation that comes for many individuals with hair loss, this is something I'm so passionate about and I want to change. Now, for individuals who have low iron, it's very common. What are the risk factors? Well, the risk factors are perimenopause, if your cycles are getting heavier and shorter together, menstruating females who have menstrual cycles, athletes, or if you're doing exercise, if you are not having enough iron in your diet. There's lots of reasons why iron could be low. It could just be diet and lifestyle, and you could just benefit from a supplement. But there's other root causes of iron deficiency, such as issues with digestive enzymes and absorption. It could be bacterial infections in the gut. It could be leaky gut. It could be autoimmune conditions. It could be inflammation. There's lots of things that we need to look for. It could be your hormones, that you have heavy menstrual cycles. If you have chronic iron deficiency, chronic low ferritin, things are not improving, then we need to look at, okay, what do we do to get you on a therapeutic dose of supplementation, of course, but also we might need to look at the gut. When I look at digestion and absorption of iron, you need to have good stomach acid. Vitamin C can help with iron absorption as well. There are certain conditions like an H. pylori. It's a bacteria that lives in the gut that produces urease, which inhibits your body's ability to absorb iron. You could have that infection. You could have celiac. You could have IBS. You could have, digestive concerns that we want to investigate. And to investigate these things, I run a GI map stool test. This is a test that you can purchase on your own. You provide the sample at home, and then you get the report. And we can review the report together and say, okay, are you digesting your food? Do you have good stomach acidity? Do you have H. pylori? Do you have bacterial infections? Do you have inflammations? Do you have gluten sensitivity? This can really help in patients where we're not seeing the results that we want. Now, in terms of supplementation, I am a big fan of using common, inexpensive iron supplements that are easily accessible. The key is you need about 120 milligrams of elemental iron for 3 months' time to raise ferritin. That's what the research says. That might not be right for you. Don't take this advice. Talk to your doctor. Make sure that you understand where your levels are, what dose of supplement would be appropriate for you. The thing to remember with iron supplements is every single form of iron is going to have a different amount of elemental iron in it. we have to look at, here's what's available. Here's the different costs. Here's how much elemental iron is within each. You know, for individuals with sensitive stomachs, you might want to do a iron that has a lower amount of elemental iron. It's not as concentrated, but take it throughout the day so it's less likely to hurt your stomach. Me, I don't want to do that. I am not going to commit to taking something 3 times a day. So I'm going to need a higher dose of iron anywhere, you know, one that's a little bit more concentrated. Now, I don't think it's worth it to spend $80 on a heme iron or $52 on a liposomal iron. When these other ones are inexpensive, they're usually really well tolerated. They're higher in elemental iron, and they're actually they have more studies available to them. So I'm all about convenience and making it easy. Now, a couple things that you can do. We talked about this, sorry, this slide I jumped ahead. 120 milligrams. This is from the AAFP, so the American Association of Family Physicians. This is the guidelines, 120 milligrams for 3 months, and then repeat the iron panel and the ferritin to see how things are moving. The best iron supplement is the one that you tolerate and you can take consistently. So I know for me, taking it 3 times a day is not going to work. So I use the 1 a day, higher concentration. Sometimes individuals need to do higher concentrations twice a day, but it depends. Take it on an empty stomach. But again, let's make it simple. You know, if you happen to have a meal in and around the time of your iron, and it's either I take it with the meal or I don't take it at all, I would argue that taking it with the meal is better. Avoid things that inhibit the absorption of iron, such as dairy, coffee, tea, high fiber, ideally 2 hours. But again, if it becomes so complicated that you end up never taking it, that's not good either. If you are experiencing nausea with it, you may want to take it with meals because it's often better tolerated with meals. If you are experiencing nausea with it or upset stomach or constipation, you can try to take your iron supplement every other day. There is some preliminary research that shows that taking your iron supplement every other day is just as effective as taking it every day. But again, we have to think, am I going to remember to do that? For me, it's far easier to put the iron by my toothbrush, and I take that iron every single night when I brush my teeth instead of the every other day dosaging because I'm going to get confused. Lactoferrin, 250 milligrams, is another really great option that can enhance iron absorption. And I find that individuals who have a hard time tolerating iron, the lactoferrin also helps. If you're experiencing constipation, you could consider magnesium citrate, but take it away from your iron. There's lots of different things. And if you're not tolerating the one you bought, try a different form. We also need cofactors for iron absorption, mobilization, and for your body to use iron. Key cofactors are vitamin A and copper. This can be found in organ meats, beef liver. I really like the Organ Synergy by Designs for Health because they tell you how much iron is within the product and is standardized. I like that aspect of it. And this is the one that I personally use. Do you have to use an organ supplement to get these cofactors to help with your iron? Not necessarily. You could also start with diet. So here's a list of vitamin A rich foods. You can Google this, you can screenshot this. Here are some examples of foods that contain high copper, but you can see beef liver contains both vitamin A and copper. That's why that one's often used. Here are a couple cases. So this individual, normal iron, normal percent saturation. The percent saturation was, a little bit higher than the optimal, but it's fine. But their ferritin was really low, 23. This is not normal. This is not normal. I like to see it 70 to 100. There's many, many websites that are now like at least 30. She's not even at least 30 here. She's at 23. So for this individual, we did 3 months of iron supplementation. Here's what we saw. We did see that the iron in the blood went up. We did see that the saturation went up. So all of those buses that move iron around are like super saturated. That is because she was taking an iron supplement. So now we say, amazing, your ferritin's 97. You don't need that iron anymore. But here's the downfall that people fall into. If you don't keep up your dietary sources of iron, if you're not looking at the gut for how you're absorbing your dietary sources of iron, if your menstrual cycles are really heavy, now that we got your ferritin optimal, it can go back down. So usually the first little bit, I am keeping an eye on those iron levels in ferritin. I'm running them every 3 months until we figure out, yes, you can maintain this on your own. Now, some individuals need to continue a low dose of iron in something like a multivitamin or a prenatal vitamin. Some individuals, they take their iron supplement for the week of their menstrual cycle. That way, as they're having blood loss, they can replace it with the iron supplement. It just depends on the individual. But again, you want to repeat your blood work to see if that works. Here is another example. This individual was, obviously significantly further in the iron deficiency progression. Ferritin was 5, the saturation was 9, the iron in the blood was total was 35. So this individual, we need to look at, what are you eating? Like, are you eating any iron-rich foods? And if you are, that doesn't make sense, right? Do we need to run a GI map test for you? What's your digestive capacity? Do you have gut infections? Do you have celiac disease, etc.? And 3 months of supplementation, you can see huge improvement. The iron went from 35 to 139. The iron binding capacity, way better. Percent saturation, 9 to 31. So way better lab results in a short period of time with something so simple. I have some patients that they just take the iron. I have some individuals that they take the iron and the lactoferrin. I have some individuals that take a digestive enzyme in their iron. I have some individuals that take all of them, the cofactors, everything. We just need to repeat the blood work and see what's going to work for you and what's going to work with your lifestyle and what's going to be within your budget. And we can create a plan that's going to help you hit your goals. So I hope that was helpful for you. If you have any additional questions, post them in the comments below.